Okay, I'm Dr. Dischliev. I work here at Westmount Square Health Group. I'm doing family medicine. I see people of all sorts of ages. A good software because I had already, I think, well, I don't know if I should name it. I had the software called Up to Date.
Yes.
So I was looking for something extra. And I found Isabel, I read the comments, I tested it, I had the trial period for some time, and then I decided to subscribe to Isabel. It was about 8 or 10 years ago. I use it, let's say, for difficult cases or in cases where the symptoms are very vague and the patient doesn't know how to describe the symptoms. It happens very often. The patient is very vague, doesn't know what he has, and he comes up with very disturbing symptoms that are not related to anything. And this is when I use Isabel. That means 2 or 3 times a week, I would say. Well, sometimes a patient comes up with different kinds of symptoms that don't seem to be related to each other. And when you see them, it can be just about anything or nothing at the same time. And if you use Isabel, it gives you a list of possible diagnoses. And then you can sort them out, choose a few of them, and work on them. And it helps to make very difficult diagnoses. Sometimes I have a few cases like that, yes. I have to see what the patient symptoms are, and I use it in front of the patient, yes, when the patient is here. Or rarely, if it's a well-known patient that I may see next time in a few weeks, I may just try this at home or on my iPad and do it myself a few hours later. But most of the times when the patient is with me. Well, first of all, I made a diagnosis of Wilson disease in a person who was in a young guy. I remember it was a few years ago, 2 or 3 years ago. The details I don't remember exactly, but he was in his 20s, he had psychiatric symptoms, and he had all the wrong diagnoses, some of them by specialists, including specialists, and they didn't make the diagnosis. I had to, and it's through the help of Isabel that I made the diagnosis, and then he was referred to the appropriate specialist. But many specialists saw that person, that boy, and they never made the diagnosis. He has all sorts of diagnoses except the right one. I think every physician, especially the older ones, should have Isabel, because it's impossible to memorize everything in medicine and to make a differential diagnosis and in your mind. I think everybody should have Isabel, including his practice. Every single doctor should, or institution, I would say, should have Isabel, yes.